So one thing that I have had a lot of problems with is hip pain, and part of it has been actually due to me wearing flip-flops all the time. I love it. Being that Washington has about 16 and a half days of sun per year, that sometimes I like to get some sun. Well, with the flip-flops, I'm causing so many more problems because there's no stability, there's no support. So shoes are kind of a big deal, but what you're checking on right now is to see if the hip, what are you checking on right now?
There's an iliofemoral joint, the ball and socket joint in your hip.
Okay.
If the hip capsules are too tight, you're going to end up having a lot more restriction in the way you run.
Okay.
And as well with ankles, if your ankles don't bend properly, that's also going to work in the up and through what's called a kinetic chain. So it's going to affect your knee, affect your hip, your low back, your mid back, so on and so forth.
And
so what I'm doing now
is by
tightness or muscle weakness in certain muscles that cause the capsule to become tight in certain spots.
Okay.
So with chronic low back pain, you end up getting a lot of back tightness, glute tightness, and then as a result, back of the hip capsule gets tight. So the capsule should all have the same tension in it, just like a ball should be equal on all sides. So this is like taking the back of the ball. The back of the ball gets really loose where the front of the ball is really tight.
Okay.
So hang on to the table.
Yep.
Relax for me. Suction on both.
Mm-hmm.
Do this one more time. And then we're going to do this ankle here. So we bend the ankle. Okay. And then retest. Equal. Good. Nice job.
So overall, one thing that I would, definitely advise, especially with hip and knee pain, not only have you take a look at it, but really I've been wearing shoes more often. I mean, however much I want to wear sandals, it's just stability and making sure that you feel better. So,
Right.
Anything else that you suggest in this?
No, I think that's great. Great patient.
Now we can't believe him. That whole thing, don't believe any of what he just said now, or did actually, because that statement clearly just totally destroyed all of your reputation.
Come on, you listen. So that's a good patient.
Thanks, Doctor.
Hey, my pleasure.